Ito po ang inyong WWC Probiotics Info at Depo Station. Handog sa inyo ng Probiotics Gift of Nature WWC Incorporated, isang private, non-stock, livelihood at humanitarian enterprise. Ugaliin ang paggamit ng probiotics, mga mabubuting bakterya na pumapatay at lumilipol sa mga masasamang bakterya na gumagawa at nagpapalala ng sakit ng tao, hayop, isda at maging sa halaman. Probiotics Gift of Nature presents a WWC Probiotics presentation of Defeat Stroke with no operation, no hospitalization, no chemical drug, no injection, using only WWC Probiotics from the Philippines. Acknowledgement. Most images used in this work were taken from so many internet publications, pictures, write-up, images. What is a stroke? A stroke occurs when a vessel in the brain ruptures or is blocked by a clot. Definition of stroke. A stroke is a neurological impairment caused by a disruption in blood supply to a region of the brain. World Health Organization definition of a stroke. Stroke is defined by World Health Organization as a clinical syndrome typified by rapidly developing signs of focal or global disturbance of cerebral function lasting more than 24 hours or leading to death with no apparent causes other than vascular origin. Kind of stroke. We have ischemic stroke and hemorrhagic stroke. Ischemic stroke. Blood clots stop the flow of blood to an area of the brain. Blockage of blood vessels, lack of blood flow to affected area. Blood clot in the middle of cerebral artery and blockade. Ischemic atherosclerosis. The underlying condition for this type of obstruction is the development of fatty deposits lining the vessel wall. This condition is called atherosclerosis. Almost 85% of strokes are ischemic. Atherosclerosis is the process in which deposits of fatty substances, cholesterol, cellular waste products, calcium, and other substances build up in the inner lining of an artery. This buildup is called plaque. Ischemic arteriosclerosis. Hardening of veins or lost elasticity also cause plaque blocking. Hemorrhagic, the second kind of stroke. Vein bursts, blood leaks and damage brain tissues, making it inutile or cannot function. Hemorrhagic stroke, weakened, diseased blood vessels rupture. Blood leaks into the brain tissue. Hemorrhagic aneurysm, ballooning and bursting of veins in brain. Distinguishing features of hemorrhagic stroke. The victim appear more seriously ill, deteriorate more rapidly, severe headache, alteration in consciousness, nausea and or vomiting, neck pain, intolerance of noise or light. Incidence of ischemic stroke versus hemorrhagic stroke and mortality. The majority of strokes are ischemic, 88% from 100%, and hemorrhagic stroke is only 12% from 100%. Mortality rate 8 to 12% for ischemic stroke, 36 to 7% for hemorrhagic stroke. What are the signs of stroke? Sudden numbness or weakness of face, arm, or leg, especially on one side of the body. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden confusion, trouble speaking or understanding. Sudden severe headache with no known cause. Sudden trouble seeing in one or both eyes. Effects of stroke. We have fast face. Face look uneven. Arm, one arm hanging down. Speech, slurred. Other signs of stroke. Stabbing sensation. Pins and needle sensation. Electric shock-like sensation. Numb sensation. Troubling sensation. Shooting sensation and burning sensation. Balance disorder. Loss of balance when walking effect. Please see images below. Uncontrolled hand. Can't handle, can't pick up. Stiff, paralyzed hand. Stroke is a medical emergency that can cause sudden disability or even death. Risk factors for stroke: inactivity, age, family history and ethnicity, high blood pressure, binge drinking and substance misuse, heart disease, diabetes, previous strokes and TIA or temporary stroke, oral contraception, obesity, unhealthy eating, smoking. Factors not yet identified: hypertension, structural heart disease, personality traits, extensive sports, genetic factor, increased alcohol consumption. During a stroke, 32,000 brain cells die every second, and quantified it is 1.9 million brain cells die per minute. 10 minutes, some brain regions, red in color, already are irreversibly lost. 1 hour after stroke, more time elapses, more brain tissues die. Urgent treatment could still limit the disability. 3 hours, the window is closing. Treatment at this time may result in moderate disability, and 6 hours without treatment, all at-risk tissue has died. The unfortunate result may be severe disability. 10 people dies worldwide every minute due to stroke. 1 in 6 people will have a stroke in their lifetime. These are statistics. 15 million people experience a stroke each year. 6 million of them do not survive. Every 6 seconds, someone dies from a stroke worldwide. Epidemiology of stroke. It is the second most common cause of death in the world, 5 to 7 million deaths annually. Approximately 20 million strokes occur globally each year. Third leading cause of death in the United States, and the leading cause of death in the Philippines. A major cause of long-term disability occur more commonly in patients 65 years and older. Risk doubles every decade after age 55 years. Hypertension, atrial fibrillations, and cigarette smoking are important risk factors. Incidence is expected to increase over the next decade due to the aging of population. Let us prevent stroke. WWC Probiotics from the Philippines. Defeat, survive, rehab stroke, no hospitalization, no operation, no chemicals and drugs, no injection, no messy therapy, and most important, it is non-expensive. Documented. I defeated hemorrhagic stroke only using WWC Probiotic Plus by Red Guan's WWC Pounder. Please see the link below at linkedin.com. The attestation, Day 1, September 1, 2015, 5 to 6 a.m. I reached out for coffee stored in high cabinet. On a standing chair, felt dizzy, seemed swirling, thought it was vertigo attack. No option but to sit down, but was astonished because I cannot stand or move anymore. I called for help. My son went down, told him I might be suffering stroke, and asked him to give me a bottle or bottles of WWC Probiotic Plus, which is good for the heart and stroke. My maintenance. Consumed more than 4 bottles of 500 ml, but I also started to vomit continuously. No panic, but my son decided to get my bed cushion for me to lie down after I told him not to bring me to any hospital. He dragged me so that I can lie down. Now, I cannot move anymore. Ask my son to call a friend who has manual micro electro machine. He tried to use it to me, but it did not do any help. Still felt numb all over, cannot move. Decided to just rest. Over continuous pleadings for me to be brought to the hospital by my son. 1 to 5 p.m. I was able to move my hands in the afternoon after resting. Still cannot stand nor walk, but I can talk, and my senses are all working. My son helped me to my computer, and I wrote a sort of a will. My mind is so clear and still very sharp. I asked for food. Yes, I have appetite. My taste bud is also working. A doctor friend diagnosed me having hemorrhagic stroke. Again, I refused heavily to go to the hospital, although he gave strong instruction to do so. Rest of the day and days next. I just rested, sleep most of the time, and continue my will for encoding and printing. My left side from head, ear, left face, left hand, left foot started to ache, but I can control it by drinking WWC Plus from time to time to stop the ache. And tingling, of course. Day 5. We noticed inflammation in my foot and hand. I telephoned my doctor friend. He said it's edema. I should go to clinic or hospital to have blood or urine tests. Probiotics can help lungs and kidney, and reason I do not need the test. I stand for it. Just use my Probiotic Plus. Day 7 to 10. Can only stand and started to walk with help from my son. I can also stand by holding much to doors, to balusters of my house. Also to a bath alone. My recovery seems very fast now. No let up. No bottle. No let up. One bottle, 500 ml of WWC Plus morning, noon, and dinner time. Day 11 to 15. I can stand and walk alone, but like intoxicated alcoholic, by holding to things, walls, and now with a cane. I also started to get out of the garden in the morning and practice my feet. My hands are going back to normal, fast, and these times I spent it by writing and researching in the internet about stroke. This was the reason I was able to write the account in less than 30 days since my stroke attack. Day 16 to 30, my first month. I can stand, walk, move freely alone, but with restraints, with or without the cane. I was almost 90% back to normal. Again, I rejected any rehab therapy, and I think I was right. I just walk. That's my therapy and continue to rely heavily with my probiotics. Second to 9 months. No problem with my physical facilities. Can move freely. Very near normal. Little abnormality is I have to wait till the small numbness gets out of my hands and feet. The numbness is already in the end part. Yes, we can defeat stroke fully. This picture reflects my condition. The pain and numbness started half of my entire body, hands and feet when my stroke started, and it moves left and side. When it gets out of the end side, I will be normal. And all are due to WWC probiotics, a gift of nature to mankind. WWC probiotics, the non-expensive natural way to defeat stroke. Fast, safe, effective, no operation, no hospitalization, no injection, no therapy, no chemical drugs, no side effects, no overdose. WWC Plus for stroke and coronary heart disorder. It has over 200 enzymes and polysaccharides. Each of the enzymes has its own use. Protease breaks down protein. Amylase breaks down carbohydrates, starch, and others. It opens the immune system as it contains 23 peptides, accelerates and regulates metabolism, and purifies body from toxins. It has antiseptic effect, destroys bacteria, viruses, and fungi, disinfectant capabilities, and stimulates cell renewing process. It increases cardiovascular performance. WWC Plus brings the human body to a general balanced state. It breaks fat globules for obese people because it has lipase enzymes. It helps ease anemia, deficiency illness, insomnia, and depression. It helps lower cholesterol level. It releases natural salicylates, a compound relating to aspirin to relieve pain. Aspirin prevents blood clogging of veins as it is a blood thinner. It triggers reduction of coronary heart disease for persons with high blood level based on study. When WWC Life Culture is combined with WWC Special Herb grown by WWC Group in its own backyard and mixed with selected enzymes, the combinations becomes a very powerful mix that is very potent to help prevent stroke. It contains 20 minerals like calcium, magnesium, zinc, chromium, selenium, and others. Also contains 12 vitamins A, B, C, E, folic acid, 20 amino acids and proteins. Its B vitamins B1, B2, B5, B9, B12 are perfect in helping neurological trouble, help take away plaques or blocks, and prevent hardening of veins or atherosclerosis. It boosts oxygenation of the blood, prevent stress, and give good sleep. Preventive and maintenance. Use or drink WWC Probiotic Plus daily, about 60 ml 3 times a day. This will help soften hardened veins and take away plaques or blocks and prevent blood clotting. It will also help thinning of thickening blood due to other disorders. Prevent stroke, prevent second stroke if you survive the first one. Suppressive. Please see my account about defeating stroke. No hospitalization, no operation, no injection, no physical therapy, no chemical drugs, fast, safe, effective, and non-expensive. When you feel dizzy, suppress it immediately as it might be a stroke coming. Drink WWC Plus daily. List of WWC probiotic products. Please open www.wwcfoods.weebly.com. Remember the World Stroke Day, which is October 29 every year. Let us fight stroke now. Start now. Get active. Control cholesterol. Eat better. Manage blood pressure. Lose weight. Reduce blood sugar. Stop smoking. And drink WWC Plus for prevention. WWC Plus. Use the proven. From the Philippines. Exclusive for members only. Ang WWC Probiotics ay exclusive lamang para sa mga kasapi nito. Pakinggan at panoorin ang aming mga palatuntunan at programa dito sa ating mga WWC Info and Depo Station. Mapapakinggan din ang Probiotics Gift of Nature ni Carod na madalas na bisita sa DCBB Super Radio GMA 7 tuwing Sabado alas 3 hanggang alas 4 ng umaga sa ilalim ng programa ni Ka Henry Ragas na Bantay sa Balita. Walang bayad ang pagsapi. Bukas po ang pagsapi sa aming samahan. Pagtanong po lamang sa ating mga probiotic professionals, mga certified HE o humanitarian entrepreneurs na nandito o sa iba pa nating probiotic info at depo stations. Hindi po ito networking o multilevel marketing. Salamat po.